I'm Dr. Steve Segal. For the last 20 years, I've spent most of my working hours helping people just like you get out of pain without medication or surgery. I'm brought in the back door to treat pro athletes, rock stars, and actors. Chiropractors said family members they have a tough time adjusting to me. Anyway, why am I telling you this? Certainly not to impress you or to brag. There's no need. No, the reason I'm telling you this is so you know that I know what I'm talking about. When you have over 20 years in the daily treatment trenches, you quickly find out that there's really one solution to a problem. And that oftentimes the solution to these problems are in pieces to the puzzle. Let me explain. I'm a chiropractor. And the way that I practice chiropractic is really from the ground up. I always watch people walk, look at their posture, look at their ranges of motion, muscle strength, and muscle flexibility. If you've ever watched any sporting injury and somebody's been injured, a knee injury for instance, you see the doctors go out there and they start checking the knee for normal motion. And they're looking to see is the knee moving appropriately, normally, or too much motion. Same thing with chiropractic. What we do is we look at the spine, look at the elbows, shoulders, knees, ankles, and wrists. When those are indicated, and we're looking for normal motion. If they're moving normally, we don't do anything. If they're not moving normally, then that's when we can do some adjustments to them. Rehabilitation. You're either working out or you're in therapy. If you get the idea of this, you're either going to be getting in the best shape of your life to sustain your next injury. At the health club I work out at, there's a cardiac rehab unit. 15 feet separate us, people who are working out, from people in cardiac rehab. In cardiac rehab, you can see through the piece of glass, and you can see exactly what they're doing. They're using the same machines, but working at a different intensity, and they're closely monitored. Revealing are quick and easy solutions that you can do at home to address some of the minor aches and pains that you might be having. Now, another piece that I have great success with, wrong spot, is acupuncture. Acupuncture's been around for several thousand years. Its origins in China are open to various people's interpretation. The whole idea, though, was back in the wartime, people would be using arrows. Sometimes those arrows would hit a spot that people had a chronic pain in, and what they found, this arrow helped curing some of their pain. Acupuncture deals with 12 paired meridians in the body. They distribute the energy, or the chi as it's called. We'll use those energy levels, we'll use the energy points, the acupuncture points, to either draw energy to an area, or if there is too much energy, to disperse it away. Acupuncture needles, when we say the word needle, people think of vaccinations or injections. Acupuncture needles aren't hollow in the middle. They're solid. They're stainless steel. We use disposable acupuncture needles, so they're used once in you and then they're disposed. Acupuncture needle has no opening in it. So there isn't fluid coming in and going out, just like on the vaccination needle. So in vaccination needles, there's something that has to go through. Or if they're drawing blood, they're trying to get something throughout. That's not the way that acupuncture works. What did that? Okay. The last piece are the other pieces to the puzzle. Other pieces to the puzzle. I use a lot of nutritional things in my practice because sometimes some nutritional things literally make a world of difference in healing. Not only healing, but we'll also use them this time of year, for instance, with allergy people. Other pieces to the puzzle consist of orthopedic surgeons, neurosurgeons, internists, physical therapists, personal trainers, massage therapists. I use them all. I'm only one piece to the puzzle. I utilize all of them, and the only person's payroll I'm on is yours. I'm Dr. Steve Segal, and that'll do it for this episode.